Hi, this is a presentation by the Fox Group Consultants to the Healthcare Industry. The subject of focus is electronic health records, especially preparing for and choosing between EHR vendors. Hi, I'm Dr. Günther Dymkowa-Fuchs, partner with the Fox Group. With over 400 vendors and counting, and about 70 or so certified systems, how do you go about narrowing the field of vendors to those that have a system suitable for your practice? It's not easy. In light of a 20% or more deinstallation rate, it is critical that we develop ways to set criteria and focus on limiting the number of systems to look at in the first place. The important question then is, what are the criteria, the ones to use, the ones which fit the way your practice operation works? Let me talk about 6 critical and a couple other criteria which are essential as an example. Elsewhere, we talked already about meaningful use and certification. Let me just say again in summary, this has mostly to do with capturing the high-tech incentive, or on the other hand, avoiding the penalties coming up. I like to spend a moment to talk about the stability of a vendor as an important criterion. A vendor should have a track record of building a strong customer base. A vendor should be able to give financial resources to continue to improve the application. We have to keep in mind that there's a considerable consolidation going on in the industry these days, and standalone systems may be more difficult to implement and connect than they were in the past. Another criteria is some vendors will only make their software available via the internet. There are advantages and disadvantages. The main disadvantage is the long-term cost, normally higher, certainly after 5 or 6 years, as compared to a vendor who provides the application on a client-server-based approach. Also, it might be much harder if you ever want to disentangle yourself from the vendor, getting usable copies of your patient and billing records if you decide to change systems. Then there is the target market of the vendor. Simply put, a vendor targeting individual small practices may be ill-prepared for the more complicated implementation and training phase required in a large group setting. On the other hand, the pricing of vendors who target large groups may be unfavorable for solo practitioners. And then there's the issue of lineage of the application. Many systems today started out as separate applications, maybe even developed by separate companies, now sold, bought, put together in a package. Initially, the information stored on these applications may have resided on separate databases, requiring interfaces. Think about it this way. If somebody developed a practice management system for billing scheduling, somebody else developed the electronic medical record system, now it's all put together by a third party. It's really critical that at the very least, systems that are composed of 2 or more previously developed applications should now be running on a common database. So you did some due diligence, you developed a list of criteria matching your operation and practice pattern fitting your practice. Now you have identified several vendors who meet those initial criteria for the right type of company and system capabilities. But you still have 5, 10 or even more possibilities. Now what? This initial vendor questionnaire is a must. This is important. An initial questionnaire to be followed by a thorough and complete RFP is an essential step to assure a good selection of your EHR system. This initial questionnaire will do a variety of things. It is a way to request and receive information from vendors that will help you decide who to schedule for web demonstrations. So what are some of the questions in the initial questionnaire? Here are some sections. General information about location of the vendor, ownership structure, length of time in business, any sale or divestiture plans. Application information, including integration issues, current release, recent release history, customer base, target market, certification pricing. Customer support includes telephone support, on-site, online, hours available, how are releases supported. Of course, references, including references from similar sized or specialty users. Implementation plans. What is a standard implementation process? What internal resources are required? What is my role? And what will it cost me? Documentation and training, including the training schedule the vendor would use, training materials, personnel, cost of training, and how systems or applications documentation is provided. And then pricing. This might be a particular challenge. In addition to base license fees per physicians, there are usually also variable charges for part-time physicians and non-physician providers, such as nurse practitioners, PAs. There are database fees, fees for use of mobile applications such as hospital rounds, fees for the patient portal, and sometimes even fees for non-provider staff, not to talk about external costs for you, which have to do with hardware, networking, and security issues. So once we get to the demonstrations, how are we going to get the most of it? You will want to see those system performance characteristics that are related specifically to the goals you have in implementing a system. How to keep a vendor on track to demonstrate what it can do for you. A specific list of features and functions has to be created and provided. Vendors usually go through their functions of the system by reviewing menus and icons available on the screen. However, how does all of this relate to you, to your practice, and to your patient flow, and how does it all fit? To avoid the problem of getting a demonstration which misses the point, you have to make sure to have a specific list of functions you want to see demonstrated and in a particular order, as well as you want to see activities that are sequential relative to the operation of your practice. This is really important now. You can improve the quality of the demonstrations you sit through by asking the vendor to go through functions you want to see based on a specific list. Let's take a look at some of those specific criteria in a list we developed. There are 8 critical and key functions. The physician in basket, which typically shows patient schedule, lab, and other test results awaiting review, prescription refill requests, patient messages, just to name a few. The medical assistant in basket, which shows patient schedule, follow-up tasks assigned to the medical assistant. Patient scheduling, including making appointments for new and existing patients, patient alerts related to clinical or administrative issues, waitlist functionality, eligibility verification, and authorization tracking. Check-in, including capturing demographics and insurance information, patient tracking within the office and collection of co-payments. Encounter documentation, including workflows for medical assistants and physician. This includes demonstration and compiling of the visit note and/or report by a specialist to a referring physician, CPT and diagnosis coding support, and authentication of the final note. Checkout, including patient education materials, follow-up instructions, and return appointments. Billing and collections, including claims, scrubbing, submission, clearinghouses, automated payment posting and account adjustments, insurance and patients' accounts receivable follow-up. And some miscellaneous items if you want, including different reports, patient portal, and mobile devices for patient, physician, hospital rounds. So, what's the next step? How to get started? In order to pick the best system for your organization, the due diligence process is critical. Not just this brief insight into how to compare vendors of EHR systems. There's more. If you would like to receive a sample list of vendor questionnaire, or learn how to introduce an EHR system into your practice, or learn something about the Fox Group in general, give us a call, drop us an email, come visit us on the web. The Fox Group, providing excellence to the healthcare community since 1989.